Okay, the first issue we're going to talk about today, related to the three topics that we're going to be discussing in your Hill visits, is mental health, occupational therapy and mental health parity. This is an issue that's been around for 20-odd years. This has been something they've been trying to pass in Congress for decades now. And we are closer than we've ever been before passing this legislation. And our Hill Day happens to come at the perfect time because Congress is expected to take up this legislation at the end of the week. The House has passed a version of their bill. The Senate has passed a bill, but there are differences between the two bills. And for a bill to become a law, they have to be identical. Negotiators from the House and the Senate have come to an agreement on a compromise bill. So they have to now go back and pass that same version in both the House and the Senate. And that is expected to happen. There's a majority of co-sponsors on both sides, on the House and the Senate. Bipartisan, Republicans and Democrats support this bill. President Bush says he will sign it, but you're never through until you're through. They've had a majority of co-sponsors on this bill far longer than I've been working in Congress, and they never passed it. The insurance lobby and the business community is concerned about the increased costs of mental health parity. They have signed on to this bill right now, but there still remains concern about what the overall cost would be. Because all too often, members of Congress and their staff have a short window of looking at what costs are, and they see as providing additional mental health benefits as an upfront cost, when everyone already understands and completely recognizes the fact that we lose so much productivity because of untreated mental illness. We have so much violence and crime because of untreated mental illness. And all of those have costs to our society. So, getting back to what Chris was saying, how do we make this local? How do we make it about them? Well, first of all, you're talking to members of Congress or you're coming from their district. That makes it local right off the bat. Talk about what occupational therapy can do for a person with mental health issues. And if mental health isn't your area of practice, think broadly about psychosocial issues. Occupational therapists treat impairments of function regardless of the cost. If somebody has traumatic brain injury, which is not a mental illness because it's an injury, and they're forgetful and have short-term memory loss, occupational therapists can work with them to address that. Well, people with depression have the same type of symptoms, and the same type of strategies can be equally effective for a person with depression. So that's a good example of how occupational therapists should be able to work with people, regardless of the functional impairment, if they can help them. And that's the idea of mental health parity, giving people with mental illness and substance abuse disorders the same level of treatment that they get for physical illness. You might get a question of whether does AOTA support the House bill or the Senate bill? I'll give you a very brief description. The House bill is more progressive. That's probably all you need to know. It's a little bit more liberal. It covers a little bit more benefits, and it affects states in a way that requires them to do a little bit more. The Senate bill is a little bit more conservative, but improves mental health coverage for millions of Americans, and both bills are good. So the compromise bill, which is in between the two of them, is definitely supported by AOTA, because it's a way to step forward and move forward. And we can make alternative little changes later when we see what happens with legislation as it plays out and is implemented. So we support parity. We want them to pass the compromise bill. That's the specific ask and request that you should have for them at the end of your discussion of mental health parity. Just a couple of quick words on this sheet. You'll see the main sponsors of this legislation in the House are Representative Patrick Kennedy from Rhode Island and Jim Ramstad from Minnesota. And in the Senate, it's Senator Kennedy from Massachusetts and Senator Domenici from New Mexico. And you can use this sheet in the package that you're going to grab at the back of the room. You're going to be able to just leave the packet with them, and it has all this information in it. But in your packet, you have one of these fact sheets that you can work from as talking points as you're going through. Read it before your visit, and take a look at a couple of the sentences you want to use to sort of highlight your point. Are there any questions about mental health parity right now? Yes, I'm going to turn it over to Chris to talk about healthcare reform.
We're expecting that healthcare reform is going to be a big issue next year. And next year in January, a brand new House of Representatives comes in, lot of the people that you are seeing today will be reelected and will be back. And some of the senators are not even up for election. So we just want you to give them a heads up that occupational therapy wants to be involved in the healthcare reform debate. That occupational therapy is part of the solution to changing our healthcare system to make it more effective, accessible, of higher quality, and meeting the needs of our citizens. So you have a fact sheet that outlines some of the principles that we would like you to put forward. Healthcare must be proactive and have prevention as part of it. Address the whole person. Include mental health and substance abuse coverage. Integrate, we need integration in the healthcare system across facilities and types of providers. We need access to quality, affordable care for all. And access to supportive services, such as services in long-term care, should be integrated into the system. Investments are needed in healthcare education because the workforce needs to be much larger in the future in order to meet the needs of people, us aging baby boomers. There's going to need to be a lot more healthcare providers. So even coming behind you, we need support for education for the healthcare workforce. That needs to be considered as they debate healthcare reform. And then the use of health information technology should be maximized. This is a key to efficiency and effectiveness and measuring quality. So these are the basic issues. You just want to tell them basically, hi John, you want to tell them basically that OT wants to be part of the debate. We want to be included in the process and included in the outcome of the process in healthcare reform. I'll just introduce John McManus, who's one of our consultant lobbyists. He works on Medicare, and after we finish this, maybe John might have some tips for people on how best to approach a congressional staff. He was a congressional staff person for many years, working for the chairman of the Ways and Means Committee. And we're lucky to have him working on behalf of AOTA. So any questions on healthcare reform? If people ask you, are you supporting Obama's proposal or McCain's proposal? No, we haven't taken a position. Our mission now is to make sure they see occupational therapy as part of the solution and include us in the debate. Okay?
All right, I'm going to talk to you now about the third issue. Medicare home health is the topic of the fact sheet. And we have a home health bill that was introduced by Representative John Lewis, who's a Democrat from Georgia, who has introduced this piece of legislation for us on an issue that we've been fighting since the 70s. We have two issues in occupational therapy related to home health under Medicare. One is that we're not a qualifying service, and one is that we're not an initiating service. In order for a Medicare beneficiary to get Medicare home health benefits, they need to have a qualifying service, which is skilled nursing, physical therapy, speech pathology services, or a continuing need for occupational therapy, which means that in order for occupational therapy to be provided in a case, first they need one of those other services, and then OT can continue on as a standalone. That's an issue that we've been trying to address for years, but the problem is the way Congress looks at legislation is that allowing OTs to qualify people for services is an expansion of Medicare or have a significant cost. Again, the short-sighted window of providing services up front rather than having people become more functional independent. But that's an argument that we can't make with the congressional budget on this. So that's as much as we need to say about the qualifying service, because the legislation that we introduced is an initiating service bill. What it does is allow occupational therapists to open home health cases when they are on the physician's order with a qualifying service. So it lets home health agencies use their skilled staff